Hey, Dr. Michael Corey here with Beat Hashimoto's Naturally. And today I want to talk to you a little bit about the brain function. You might have some issues as far as how the brain's actually working because your thyroid is not working. I want to show you the link with that because what happens is we've got energy that's produced. And actually that's my first slide. I'm going to show you, I'm asking 30% of our energy comes from what system? We can look at the endocrine system, the digestive system, the nervous system, the immune system, cardiovascular system. But the answer to that is the nervous system. Nervous system includes the brain, the spinal cord, the nerves going to every muscle, cell, and tissue of your body. It's miraculous how our body actually works. We think that it's just working functionally, it's just on autopilot, but there's millions and millions and trillions of neurotransmitters and things that are happening on it each and every day, every second as we take a breath in, as we breathe, as we can think and we can go through and regulate our life and our function, digestion, fuel and activation, all that good stuff. But we need proper functioning of the thyroid to regulate all of those functions. Nothing works by itself. In medicine, we've gone through, in healthcare, they've divided and everything's into a specialty. Gastroenterologist, your neurologist, your endocrinologist, your rheumatologist. You might have all of those doctors when in actuality what we want to look at is what is the underlying cause of your dysfunction. It's super, super important to look, and I want you to understand that that thyroid has a brain connection. And when we look at how that works, your thyroid supports bone metabolism through the brain and nervous system, your immune system, your brain and nervous system's regulation, your endocrine system, including the adrenal glands, your insulin levels, your glucose metabolism, also your endocrine system of ovaries and testes for fertility issues, gastrointestinal function, proper stomach acids, healthy cholesterol, fat burning, sex and growth hormones, and liver and gallbladder. All of that is regulated. Every muscle, cell, and tissue of your body, in fact, has to be regulated through your thyroid. So every cell in your body has thyroid receptors, and as we look at that, your body has to function properly, and it has to do that through what I call crosstalk. Your thyroid is talking to your immune system, it's talking to your gut, it's talking to your brain, it's talking to the endocrine system, it's talking to the hormone systems and your endocrine system. And as we go through and we look at that, it happens from the brain. So we have to always make sure we take care of the brain with making sure that we're doing things to decrease inflammation. Because if you get inflammation in your brain, you've got a fire going on everywhere else as well. If you've got a fire going on in your gut, you're going to have a fire in your brain. And they're very, very important to note that. So we're going to look at your hypothalamus up in the brain, and that's going to release thyroid stimulating hormone. Once that thyroid stimulating hormone comes down and hits the pituitary gland, the pituitary gland is going to go through and it's going to be reactive. It's going to go through and it's going to secrete growth hormone, which is there for your tissue repair. We're going to also secrete your luteinizing hormone and your follicular stimulating hormones. So any of you out there that have fertility issues, we want to make sure that we are going through, we have this cascade from the hypothalamus to the pituitary. We're getting the luteinizing and follicular stimulating hormone to affect the testes and the ovaries to give you the functions of your menstrual cycle. Also for the guys, the testosterone levels. So this is a very, very important aspect to our sexuality and how we feel as far as from our reproductive capabilities. We're going to also come back and I'm going to go through and just talk about the ACTH, and we're going to affect the adrenal glands. Once again, going back to the thyroid, the adrenal glands, all of these are part of the what we call the web of physiological dysfunction. But the adrenal glands secrete from the cortex, the cortisol, your aldosterone, your progesterone, DHEA, and then medulla, the epinephrine, and the norepinephrine to give you the energy, the up, and the boost to make sure that things are working right. From the pituitary gland looking down at your thyroid now, that pituitary gland is going to come down, it's going to stimulate thyroid stimulating hormone. That thyroid stimulating hormone is going to interact with the thyroid gland and your thyroid peroxidase to add your iodine molecules on top of your hormones. So as we go through, we get 97% of T4, the inactive form of your hormone. We get 3% of T3, the active form that actually has to go in and do the job of the thyroid to have all of this talk with all these organs. Now, T3 and T4 is carried like a little bus. It's a little carrier, and we call that thyroid binding globulin. It's like a little taxi cab. That taxi cab's going to carry T3 and T4, And as that T3 and T4 moves throughout the system, we're going to see that T4 get T4 and the active form of T3. Now remember, T4 is inactive. We got 97% of that. And the active T3, which is 3%, that gets shuttled off to 3 primary areas. 60% goes to your liver, 20% goes to your gut, and 20% goes to other tissues. And as we see that process of that conversion from T4 to T3, now we've got free T3 that goes back and it goes into the receptor site and it can activate and actually get into the cell again. So there's a whole cascade. It's a dance. Your body is constantly dancing. It's like the Philharmonic and listening to all these different frequencies and all these different sounds, and that's exactly what's happening to you from an endocrine standpoint. So when your endocrinologist says that your thyroid levels are normal and you're within that big wide range I talk about on some of the videos, we're within that wide range of traditional values. He says everything's normal. Has he checked to make sure that this system's working right? That we have a hypothalamic to pituitary to thyroid to organ and tissue function? I say not. Usually not, because 90% of people out there with hypothyroidism is estimated to actually have Hashimoto's thyroiditis. So all these weird symptoms that people throughout the country and throughout the world are experiencing, and they're not linking it into the thyroid because doctor says that they're fine, everything's good. Okay, we need to be a MacGyver. We need to be an investigator and go through and take control over this, learn this, understand this, and I think that you're going to be a whole lot healthier. Along the way, I'm going to show you videos on every one of these steps and how this is integrated and affects your health in different ways and how to make some corrections. I'm always available for you. So if you have any comments with this video, by all means, put some comments underneath here. I'll respond to you and I can answer any questions that you might have along the way. But above all, Beat Hashimoto's Naturally is here for you, and I want to make sure that we address questions. I know a lot of the other pages people don't answer, and doctors don't answer if there is a doctor there. Most of them are patient run. But I want to give you direction. I want to help you along the way. I want to bring you back to the healthy state that you deserve to be in. My name is Dr. Michael Corey, and I'll see you on the next video.